Hello, this is Manny Ramos, your host of Rise Up, Real Issues and Stories of Every One of Us podcast. First, let me talk about who we are. I'm Manny Ramos, a board member of PNAA, a past president of the Philippine Nurses Association of Central Florida. I'm a professor of nursing at Valencia College in Orlando and an adjunct faculty at William Patterson University. With me is my co-host, Mindy Ofiana. Mindy?
Thank you, Manny. I'm Mindy Ofiana, Legislative Committee Chair for PNAA and a corresponding secretary for PNA Foundation and past president of PNA Southern California. Currently an adjunct professor at Charles R. Drew University, Department of Medicine and Sciences here in Los Angeles. Manny?
Thank you, Mindy. Today, our guest is Dr. Sigrid Ladores. She's an associate professor at University of Alabama in Birmingham and is director of the PhD program. She's an associate scientist at UAB's Cystic Fibrosis Research Center, Minority Health and Research Center, Center for Women's Reproductive Health, and Center for Palliative and Supportive Care. Dr. Ladores investigates reproductive health concerns in adolescents and young adults with chronic illnesses and has presented her research in local, regional, national, and international conferences. She's also a respected scholar and leader in the Philippine Nurses Association of America, serving as the chair of the research committee. Dr. Ladores, welcome back to Rise Up.
Thank you, Manny, and thank you, Mindy. Thank you for inviting me to come back. I guess we had fun the first time around, right?
That's
Yes, we
right.
surely did.
Well, welcome back, really, Dr. Ladores. Or do you want me to call you Sigrid?
Please call me
Um,
Sigrid. My goodness. Yes.
okay, all right. So, really, it was nice of you to accommodate us again to talk about your interest in research. With that said, though, can you tell us a bit about your background and how you got interested in the subject of research?
Sure. Yeah. So, research was probably very far from where I thought it was going to end up. I think I shared in my previous podcast with you all that I came from a very humble town of Iloilo City. Actually, my other hometown that I would call my hometown is Dumalag, Capiz in the Philippines. So, very humble beginnings. Thought that it was very exciting as a 15-year-old to immigrate to the US. I was most excited about the ability to wear lipstick as a teenager rather than thinking about career options. And so
Yeah.
I thought I did not want to be a nurse, honestly. I fought with my dad when it came to filing paperwork for, declaring your major as you applied to different nursing schools. But he's very pragmatic and said, "What are you going to do with a journalism degree?" Because that's what I wanted to do. And
Oh,
he
wow.
said,
Wow.
"What are you going to write about? Who's going to pay you to write about things? How are you going to pay your bills and put food on the table?" Very pragmatic Asian man. And so I
Mary
listened to
parents.
him, I fought with him, and I said, "Well, how about if we compromise?" And I try nursing school for one semester. If I don't like it, I'm going to switch out majors. And so we shook hands and I kept my promise. I said, I'll give it my all, I'll give it my full try. And thankfully, the first semester of nursing school at age 17, I ended up liking it. And so here I am,
Ah,
actually
Wow.
celebrating my 25th year college reunion this coming weekend. 25 years
oh,
ago, I
wow.
graduated from
Wow.
college
Oh,
nursing
Wow.
wow.
school. So, yeah,
Oh,
it
wow.
worked out
Very
Cool.
okay.
young.
But, research was far from my vision because I was happy being a nurse. I was a pediatric nurse. I did a lot of different
Uh-huh.
things in pediatrics, mostly in Florida. I worked at different hospitals there. I did home health nursing. I was a field supervisor. I did quality assurance. I did some travel nursing. But then I was offered a position to be a faculty member at the University of Central Florida in Orlando. And that's how I met Manny through my work with PNA Central
That's
Florida.
right.
And I
Right.
really enjoyed, being a faculty member. And I remember our associate dean for research at that time, actually, she was a director for research. Dr. Karen Meneses, our beloved Dr. Karen Meneses, may her soul rest in peace. She died in 2018 unexpectedly, but she is a fellow Filipina, and she was a high-ranking,
Yes.
world-renowned researcher and the kindest, most humble person you'll ever meet. And so she's the one that said, you cannot stop with a master's degree. You have the potential to have a doctorate. Go for it. And so thankfully I listened to her, and she said, at that time when I started, the DNP was really not an option yet. It was just starting. And so she said, I want you to think about the PhD route, because that is a well-established degree. And it was offered in the same school where I was teaching. So I could take classes, for free and get tuition reimbursement and so on. So, I said, okay, well, if you think that that's a good, path for me, I want to stay in academia. I wasn't so thrilled about the research part, to tell you the truth. I just wanted to be able to continue teaching and have security in my ability to teach as a PhD prepared nurse. And so that's why I went to the PhD program, and thankfully I ended up loving it also. I was bitten by the research bug. And so kind of a roundabout way, I ended up in research. So long story.
Okay, so you're very well known now in research, especially there at UAV and of course at PNAA. Can you tell us a little bit about your focus as far as research is concerned?
So yes, in my research, I focus within the patient population with cystic fibrosis. So cystic fibrosis, I'll explain a little bit. It is a genetic disease, autosomal recessive transmission. So sort of like sickle cell disease, where you inherit, one gene from the mom, one gene from the dad. And if you put them together, then you have a 25% chance of having the disease. So that's what CF is. There is an abnormality on chromosome 7 that causes an alteration in what's called the CFTR regulator protein gene. And this gene is very important because if it's altered, it leads to lots of problems in the body. So it's a multi-system, progressive, incurable disease. And it affects, multiple systems head to toe, but it causes, for the most part, thickened mucus. Your body produces overly thick mucus that then gets trapped in the lungs. So then if you have really thick secretions, you can't cough it out, then you have lots of lung infections. And many of our CF patients end up needing a lung transplant, for example. So it causes GI issues. It causes reproductive issues. So I do a lot of my research with the CF patient population, and mostly I look at quality of life issues, because that's what I'm most interested at, as a nurse scientist. I look at fertility issues, sexual and reproductive health. I have a project on palliative care, embedding a palliative care specialist as part of a CF care team, for example. I even have a project on smoking cessation, to help caregivers or family members of young children with CF, and those family care members who are exposing their children to smoke, to help them stop smoking. So really anything that they invite me to do, or, I have a passion for really improving the lives of people with CF
Mm-hmm.
and the care that they receive.
Uh-huh.
I see. So, how did you become interested in cystic fibrosis?
Well, Mindy, if you were paying attention to our first podcast, you would have found out about my
I know,
husband.
but this is how about the others who have not received
I
have not
know,
heard
I'm
about
just
our
kidding.
first podcast?
I want them to go back and listen to that podcast after they listen to this
That's right.
podcast,
That's
right?
right.
Go back.
That's right.
That's true. That's
So,
true. Yes.
I am personally
It's
connected to CF, not just professionally, but personally. So, my husband of almost 23 years has CF. Again, he was born with it. He was the classic textbook case of CF. And I was thrown into the world of CF, more from the spouse side, the caregiver side. And we've been through really the ups and downs of CF because, he had to have a lung transplant. We just celebrated our 10-year anniversary, lungsiversary, or breath
Wow.
day. 10 years ago, he
wow.
had a lung
Yay.
transplant.
Oh,
Yep, and
wow.
he's doing well for the lungs. And you know, it's been a roller coaster. Many
Mm-hmm.
of you know, especially the nurses, know that transplant is not necessarily an answer. It's not a cure. You're essentially trading one set of problems with another set of problems because these anti-rejection meds are really tough on the body, and but you have to have them in order to protect your donor organs. Otherwise, you'll get rejection and
Mhm.
all kinds of awful things. So I got invested into CF because I've gone through the ups and downs of CF. We've been through 13 cycles of fertility treatments, for example, to make our two boys, our two sons.
Oh.
So that's why I'm very interested in the fertility and sexual and reproductive health issues in CF. So the work I do is really informed by and inspired by the people that I know with CF, because the CF community is small. This is considered a rare disease. Only
Yes.
30,000 people in the US has CF, and about 70,000 worldwide. So it's not like cancer, it's not like heart disease, right? Or dementia, all the kind of the big names, HIV, AIDS, things like that. So you get to know the CF community very well. And so they tell me, they come to me and tell me that this is important to them. And why wasn't
Mm-hmm.
I studying it? That should be my next project. So they really tell me what I need to be doing, which is great because, it's directly from them.
Uh-huh.
Yeah.
I see.
I've seen some of your posts because I do follow you in Facebook
And I follow you,
about
sir.
you would go you have posted whenever you would have gatherings with the cystic fibrosis, what do you call it, a family, a group,
Yes.
um
Camp.
can you tell us
Yeah.
more about that, the camp? Yeah, can you tell us a little bit more
Yes.
about that?
Sure. So this is a camp that provides respite, provides education, and it's an annual camp pre-COVID. Of course, everything changed with
Mm-hmm,
COVID, right?
mm-hmm.
But this is a
Right.
very special
Yes.
camp that that my husband attended when he was 6 years old. So he
Mm-hmm.
was one of the first campers. Their very first camp opened, and my husband was 6 years old, and he pretty much attended every year. It's an annual camp, usually
Wow.
somewhere in Florida.
Ah.
And as he
Uh-huh.
aged through the program, he transitioned from being a camper to becoming a camp counselor. And then now he's the president of that camp. So this is our
Wow.
way of giving back to
Wow.
the CF community
Yeah.
and to this Sunny Seashore
Yeah.
Sea Camp is what it's called. And this is who
Sunny
we
Seashore
call our
Sea Camp.
CF family. Yep. And it's essentially 4 or 5 days of free time. We
Wow.
pay for their hotel, we pay for their food.
Uh-huh.
All they have to do is just get there, get to Florida, and we take care of the rest.
That's
But it's a good
awesome.
way, yeah, to kind of get
Oh,
together
that's
and
nice.
um, you know know that you're not alone, that there are many
Mhm.
other people and families
Uh-huh.
dealing with the
That's right.
same
Mhm.
stuff, because CF is a really hard disease.
I see.
It's
Uh-huh.
not glamorous. You cannot
Uh-huh.
take a day
I can
off.
imagine.
Every
Right.
meal you take, you have
Yeah.
to take in your pancreatic enzymes or you get a belly pain. It's a really tough disease. And so for especially the young kids with CF, it's hard for them because, as a pediatric nurse, I know that all they want is just to be normal, right? To be just like everybody else, just like their friends.
Mm-hmm.
And when they can't do that, it's very hard on them. And there's lots of depression and
Mhm.
anxiety that happens in the CF world.
Wow. That's nice
Yeah.
to hear. It looks like it's very successful with regard, especially the camp. Is that a foundation type
Yes, it
thing
is. It's
or
yeah,
no?
it's a
Uh-huh.
501c3,
Oh,
and
Mhm.
it's
C3?
it's we
I see.
fundraise for it.
Mhm.
We don't take any money from
Oh, okay.
anyone. And
Uh-huh.
again, usually we have about
Wow.
75 families that we invite,
Wow.
and they get 4 or 5 days
Wow.
of just having a little bit of a summer break. And
Mhm.
not only do they
I
have
see.
fun in the
I see.
sun or usually on a beach because salty air is good for their lungs. They
Right.
have exercise.
Uh-huh.
We have usually a couple of lectures where we invite our medical director, for example, or myself to give updates on what's up and coming in CF research. So it's
Mhm.
not just fun and games. We actually do infuse it with some educational content so that the
Neat.
families come and they
I
get kind of the
see.
most recent things happening in clinical care and research.
Yeah. Okay.
Uh-huh.
Well, thank you for that information. Would you mind sharing what you are currently working on in research, or what are some of your funded projects other than the camp that you mentioned?
Yeah. So one of the things that I'm working on is actually funded by the CF Foundation, and it is looking at
Mhm.
fertility preservation
Mm-hmm.
in men with CF before they have a lung transplant. And the catalyst for this project was
Oh.
I was talking with a husband and wife. The husband has CF, had CF. He actually
Mhm.
passed away recently, but he was at that time about a year after transplant. And they've been
Mhm.
married for a little while. They were actually high school sweethearts. Okay. And
Mhm.
so, because of the husband's
Mm-hmm.
declining health, they decided to wait to have children because they knew that, as you remember, having children, you have sleep deprivation. It's just a really hard time being new
Yeah.
parents. And
Right.
so, what ended up happening was they waited at least a year after his transplant when he was more stable, his lungs are good, his meds are stable. They
Mhm.
went to see a fertility specialist. And during that first consult, the fertility specialist sat them down and said something that they did not expect. So the fertility
Mhm.
specialist said to them, "I'm sorry, but I do not recommend that you use your own sperm because you
Mhm.
are on anti rejection meds.
Oh.
That can have teratogenic effects that we don't know of."
Oh.
So he said, "I
Mm-hmm.
recommend you use donor sperm instead."
Mhm.
So when he heard this, he felt like he was punched in the gut. He said that
Mhm.
he almost fell off his chair because no one ever told him that he
Mhm.
needed to actually do the sperm aspiration and cryopreservation, freeze the sperm before transplant, which for men is actually a pretty easy, relatively simple procedure compared to what the women have to go through. And I know this because I was a professional infertility patient for many, many years.
Yeah.
And so he was so disappointed. He was shocked. He was angry. And he said, why did anyone tell me this?
Mhm.
He felt that his ability to have biological children was taken away from him, that he wasn't even given that chance because someone did not tell him that he should have frozen his sperm before transplant. And so that started this idea for me, like, oh my gosh, you know, we need to do a better job telling our pre-transplant patients, not just CF or lung transplant, but transplant in general, right? That if they're gonna embark on a transplant journey, then they need to know that this is probably something they want to do if they want to have the ability to have biological children. So it's very similar to what our oncology patients go through. Now, you may know this, you know, it's standard care, right? That when a woman, for example, gets diagnosed with, I don't know, breast cancer, you know, cervical cancer, whatnot, some kind of cancer that requires chemotherapy or radiation, part of that dialogue with their provider is fertility preservation. They talk about the impact of chemotherapy and radiation on their reproductive health and their organs. And so they recommend that, yes, you need to, you know, harvest your eggs and freeze them, cryopreserve them just in case you ever want to have the ability to become pregnant or have biological children, even through surrogacy later on. And so, unfortunately, a lot of work has been done with the oncology population. It's not the same with the transplant population. So that's what I'm trying to do. I'm starting with just my CF little population that I know, with a lung transplant population that I know, and hopefully the results of this project can be applied to other transplant populations. So that would be the next step. So that's kind of what I'm working on among other projects.
So,
That's nice to hear.
Sigrid, in addition to the research on fertility issues, what are the other research priorities in CF?
Oh, great question. So, research priorities in CF right now is finding a cure. Finding a cure. So the CF Foundation, which is the big organization that heads the philanthropy side, the research side, clinical care, I mean, that's a big foundation that we refer to. They're committed to finding a cure. So they're spending a lot of money, you know, funding different projects to see if we can find a cure through gene editing and gene therapy. So those are the two things that they're working on. Even though we've had some recent successes through what we call our highly effective modulator therapy. So I'm going to just make it simple. These are precision medicines. We call them modulators. And these modulators actually address the physiological problem in CF. Remember that CFTR protein that's altered. These medications go in there and fix it, okay? But it's not 100%, and not everybody are eligible to be on these modulators. And so, and these modulators have bad side effects too. You know, we're hearing a lot of issues with mental health on these modulators. Some people gain a lot of weight, and so body image issues become a problem. So there's a lot of other considerations. The modulators is not a cure. It's great and it's life-saving, and it can be a miracle drug in some people's cases, but it's not for everybody, and it doesn't work well for everybody. So really what we're pushing for right now is the cure, which is gene editing and gene therapy. And there's some movement in that, mostly in Europe right now, but we're also making headway here in the US.
Uh-huh.
Sorry.
Oh, that's good. You know, in research, I venture to say, and you know this more than I do, there are successes. I'm hearing it from what you just mentioned a
Mm-hmm.
while ago, but there are some
Mm-hmm.
challenges. What would that be? What would be the challenges in cystic fibrosis
Okay,
research?
so yeah, challenges that I can think of right off the bat is money, right? Research funding.
Mm.
Remember that CF is a rare disease. So there's not a whole lot of money,
Mm-hmm.
right, to be had if you're only catering to 30,000 people in the US. Research and development dollars, I mean, that's millions and billions of dollars being spent to develop these
Millions, yeah.
modulator therapies. And so they have to somehow recoup that, right? That's why the prices on these medications, a
Mm-hmm.
1 year supply of one of these medications called Trikafta, if you don't have health insurance, is over $300,000 a year. Who can afford that, right?
Yeah.
And
Whoa.
so
Yeah. Oh
it's
my.
very expensive to come up with these modulators. Research funding is really, prioritized for those that have higher impact.
Mm-hmm.
Again, I'm talking about oncology,
Mm-hmm.
HIV, heart disease,
Mm-hmm.
right? Those are the big winners, if you want to call
Mm-hmm.
it like that, when it comes to getting research funding dollars.
Mm-hmm.
For CF, it's we're lucky if we get a little bit here and there. So we're constantly trying to fundraise
Mm-hmm.
and find good philanthropy and organizations that would partner with scientists to help come up with some of these interventions that could
Mm-hmm.
potentially help. And I guess another issue,
Wow.
another challenge that we are experiencing in CF research is getting people into clinical trials, right? So study
Mm-hmm.
participants who may hesitate
Yeah.
or they're nervous about joining a clinical trial or a research study. I would have to say that in CF,
Mm-hmm.
thankfully, we have a lot of our CF patients, they're used to participating in research.
Mm-hmm.
Um, we actually have one of the most robust and accurate CF patient registry. It's a data that's compiled on all the people in the US, and
Mm-hmm.
there's a counterpart in Europe where they collect lots of demographic information on the patients. And this is gathered through CF Foundation accredited centers across the US. And so there's about 120 of these CF centers, and they all get their data together and submit it to the CF Foundation. And so the patients who get seen in the CF centers, they're used to participating in research. But the issue here is that some of them have
Mm-hmm.
research participation fatigue, meaning they're
Mm-hmm.
being asked to participate in
Oh.
probably 5 studies in 1 week, right?
Wow.
And so that can be drug trials, that could be
Wow.
device
Mm-hmm.
trials, that could be behavioral intervention studies, things like
Mm-hmm.
that. And so because we're only dealing with a small number
Mm-hmm.
of people, the same
Mm-hmm.
people are going to get asked over and over and over. And so the importance of participation is really key. And
Okay.
right now, what's really hard to get are patients with CF who belong to racial and ethnic minority groups. Okay, so when we
Mm-hmm.
think of CF, usually what comes to mind, especially in our textbooks, are Caucasians or those from European descent, because the
Mm-hmm.
majority of patients with CF are Caucasians. However,
Correct.
because of global travel and intermixing, right, we are now seeing more and more of our minority groups, underrepresented groups, being diagnosed with CF, but at a later stage. So usually we get it during newborn screening, and they get a sweat test and it's positive as an infant. But now we're hearing about 40, 50, 60-year-old men and women with CF getting diagnosed for the first time,
Oh.
even
Wow.
though they've had symptoms all along.
Wow.
Their symptoms are mild. Okay, so maybe they were misdiagnosed with
Oh.
asthma because they've had a wheeze all their life, right? Maybe they were misdiagnosed with COPD because of their breathlessness, and their dyspnea. Maybe they were
I
diagnosed with
see.
IBS, even though that's
Yeah.
really CF, with a CF gut. So now they're coming back and seeing, wow, we're seeing a lot more African Americans being diagnosed later with CF. Latinos are getting diagnosed with CF later in life. In fact, I just found out there was one little girl in Thailand that was diagnosed with CF. And I saw her profile on one of the CF
Oh.
Facebook pages that I follow. And it's quite an amazing story, but you don't really hear of Asians being diagnosed with CF, but this little girl has it. And so it's just a matter of time that we're seeing some of these rarer mutations in CF.
Mm-hmm. Mm-hmm. I
So,
see.
Sigrid, what
Oh.
would you like to say to our listeners who may be hesitant or concerned about participating in research studies or clinical trials?
So I would say ask the questions. You're not forced to participate in anything. This is all voluntary. If you're nervous about something, if you're not sure, ask the principal investigators, the research team, all those hard questions. Ask about potential side effects of medications, ask about the benefits. So sometimes, we get nervous about the unknown, and rightfully so, right? But
Right.
if you have a conversation with the research team, they'll be honest with you and say, look, the risk is minimal. Okay. Not more than minimal risk is really what we like to say in research. And so have them have a conversation with not just the research team, but with their clinicians, their care teams, to say, oh, it's okay, the risk is minimal, but the potential benefits far outweigh the risks. And so we also want to, I guess, I don't know, appeal is the word, appeal to the altruistic side of people. Meaning we want to let them know that even if the results of this study does not benefit you today, the results will actually inform the next steps of what we need to do so that future patients and future generations can actually benefit, right? This is how science keeps moving, right? Someone's going to have to actually participate in order to move things along and to advance progress. And so that altruism, especially for a small group like CF, most of them do agree. Once they see that, I've heard parents say to me, I know that this might not help my baby, but if it can save another baby 10 years from now, 20 years from now, from having to go through the same pain that my baby's going through, absolutely, I'll do it. Okay. So that's what I would say. Ask the hard questions, don't be afraid to have those types of conversation.
I see. Well, before we end, I want to talk about something
Okay,
lighter.
let's do it.
about, and I know you're from
Yes.
Iloilo. Okay, I know you're from Iloilo, and you're from the town of
Yes.
Molo. So I love pancit molo. So for those who does not know pancit
Yes.
molo, our audience, can you describe this
I
food
think
to us?
Mindy and Manny, you both can describe it as well as I do. I unfortunately, I think you've eaten it. You know what it is. It's just one of the best little
Yeah,
soups that
it
you can
is.
have, right? It has a clear broth. It's
Yeah.
Yes.
like a dumpling
Uh,
in the broth and just a little bit of meat with a soft
uh,
wonton shell. It's really, really,
yes.
I don't know. It's just really good.
Delicious.
Um, it's delicious, yes. And of
That's
course,
right.
the other thing that we're known for in Iloilo is bok choy. So I'm not sure if you've ever
But
had
joy,
bok choy.
yes. Oh, wow.
Oh yeah,
We're
Yeah.
bok choy.
famous
We
for bok
know
Yes,
choy.
another one.
Yes.
yes. We have
Yeah.
actually we have a
Yeah.
restaurant
How
here
about, you
that
I'm
know,
so
sells it,
jealous, Mindy.
uh,
but it's in Los Angeles.
I also love Sigrid. I also love piaya.
Oh, piaya is
The
so good.
it's
Yes.
What's piaya?
yeah, it's a
Flat,
flat
flaky pastry.
flaky with sesame seeds and the on the
And
top,
it
and the
has
filling is the
sugar.
best one.
Yes,
Yeah.
it's sugar.
Yeah.
So it's not good if you have
I'm
diabetes.
diabetic. I can't have it.
Yeah, but the crunch when you bite into it,
Yes,
and then the filling, it
yes.
melts in your mouth. Oh my goodness.
Piaya. I
Oh,
have not
it's so
heard of that.
good.
Oh my
Yeah.
goodness.
Make
Shame
sure
on
you
me.
eat it over a
All
plate,
right.
unlike my children,
Oh
because
gosh.
it goes all over the place. It's very messy.
You know how to cook it?
No,
You know how to cook it? You know
I
how to cook
don't,
it? No.
unfortunately. I wish I know how to cook these things,
Oh
but
wow. I was gonna ask you to
oh,
bring
you're
it at New
funny,
York.
Mindy. I
I was gonna
I think there's plenty
All
of
right.
restaurants in New
Oh
York
my
where we can
goodness.
go eat some good food. Yes. I can't wait to see you
Piaya?
guys.
All right.
I know it's been a while. Me too. I'm so excited to be in New
Okay,
York.
and that is all that we have for this episode. I want to thank our guests, Dr. Sigrid Ladores, my co host, Mindy Ofiana, our director and producer, Rodney Cahudo, Caro Robles, our PNAA chair for communications and marketing, our advisor, PNAA Foundation President Nancy Hoff, and our executive producers, PNAA President Dr. Mary Joy Garcia Dia, and PNAA Executive Director Carmina Bautista. Join us every week here and Rise Up. Until then, keep on rising. See you next week. This program is made possible through the NIH All of Us Research Program. PNAAF is a national collaborator of the Asian Engagement and Recruitment Corps launched by the Asian Health Coalition, which is a national community engagement partner for the NIH All of Us Research Program.